My name is Gianni Ricci. I'm an orthopedic surgeon at the Hughston Clinic, and I specialize in orthopedic foot and ankle surgery. So I grew up in Pittsburgh, Pennsylvania, grew up in a hardworking Italian American family, and I was fortunate enough to play football at Davidson College. So I started working my way south, actually, when I was in college. And then while in medical school, I had an opportunity to do a couple medical school rotations in Columbus, and that's what first brought me here. And fortunately, I was able to meet my wife here in Columbus. She is a labor and delivery nurse, and she worked at St. Francis and Midtown Medical Center downtown at the time. And then fortunately, I was able to match into my first choice of residency, which was at orthopedic surgery at the Hughston Clinic. My inspiration to become an orthopedic surgeon actually began in high school. I had sustained a high ankle sprain while playing football, and I was able to meet an orthopedic surgeon at the time. He really sat down with me. He was able to treat me non-operatively and get me back to playing football and playing the sport that I loved. And then when I went into medical school, I was such a visual learner. I really enjoyed being in the anatomy lab, performing dissections and using my hands in order to treat patients and help fix their problems. So I was able to have the best of both worlds, treat the everyday athlete, but also use the anatomy as well as use my hands in order to help get them back to doing what they love. What I enjoy the most about my job, specifically for orthopedic foot and ankle, is to be able to see a patient who has had a really difficult time from a functional standpoint. Sometimes they're unable to walk, they're unable to play with their children, they're unable to play with their grandchildren, they're unable to return to the sport that they love, or just do the things that they want to do in life. And then for me as a surgeon, I'm able to identify their problem, and whether it's non-operative management or surgical treatment, I can get them back to doing what they want to do in life. I mean, that's why I wanted to become an orthopedic surgeon. What has advanced our profession the most in orthopedic foot and ankle surgery has been ankle replacement surgery. Over the past 5 years, even in 10 years, our implants for ankle replacement have been excellent. And I do find it surprising still today that patients don't know that that's an option for their ankle arthritis, that we can go in similar to like a knee replacement or a hip replacement and actually perform an ankle replacement. That is able to preserve their motion while also getting them back to the things they want to do in life pain-free. My role model and mentor in life is my father. We come from a pretty blue-collar, hard-working Italian family in Pittsburgh. We own a Italian sausage company that's been in our family since the 1940s. And my dad and my grandfather both really just instilled a work ethic in me that I'm very grateful for today. The Hughston Clinic is a special place for me, first because I trained here as an orthopedic resident. So I've been in Columbus for 5 years, and my now partners were my attendings in residency. They taught me how to see patients, they taught me how to operate, they taught me how to be a good surgeon and a good person. That's what makes Hughston Clinic special to me.